So we're at IADH in Chicago 2016, and we've just come straight out of the coagulation track, which was delivered by Dr. Daniel Nance, Dr. Kirsten Fitzgerald and Dr. Graham Ting. So it was very, very well attended. But Dr. Nance, could you tell us what the session was about?
Well, we covered a lot of ground, a lot of different hemostatic areas, different conditions that lead to bleeding. I focused a little bit on the coagulation cascade and bringing that into 3D, so a little bit more discussion about how hemostasis happens, and in order to help our colleagues in dentistry have a little bit better idea of what it is they're actually doing when they're administering the coagulation or antifibrinolytic products.
Thank you. Dr. Fitzgerald, you're a paediatric dentist working in Ireland. Can you tell me what were the key points in your presentation?
I talked about a few of the systemic conditions that can cause bleeding in the dental setting. So I looked at children and adults who have cardiac problems, liver disease, renal disease, immune-mediated disease and bone marrow failure. And then I talked about the different aspects of those conditions that can cause bleeding. And then after that I talked about the importance of building relationships with the teams that look after those children and adults, so that you can manage those patients appropriately in a team setting and in a team environment, so that everybody's playing their part and that we can get the best care for our patients.
So Dr. Graham Ting, you're working in London at King's College, but you've also of New Zealand and Australian origin. So you talked about the global aspects of haemophilia care. Can you tell us a bit more about that?
Yes, the theme of the conference is reframing special care dentistry in a global perspective. And so what I wanted to do was provide some information for developing countries to think about the ways that they may be able to provide good dental care for people with bleeding disorders, but not necessarily rely on published papers that came from perhaps the internet, and perhaps where they couldn't afford or didn't have the resources to implement the protocols that they read about.
Okay. Did you get any good questions from the audience? Did you get any good questions?
I didn't get any questions. I was very lucky. I didn't get any hard questions or any easy ones.
Dr. Nance.
One of the questions or a couple questions that we talked about were how to manage inhibitor patients that need FIBA or recombinant factor 7, and which one might be safer in connection with antifibrinolytic medications. And there's really no consensus on that. I think you have to just look at each individual patient and evaluate their bleeding symptoms and treat them as you go. And the other question that we got was whether or not the product choice can really influence the inhibitor development, and of course we're still waiting for the results of the SIPPET study in order to be able to answer that question and then figure out what we might do to reduce the risk of inhibitors.
Graham, you talked a little bit about the World Federation of Haemophilia. What can they offer for dentists as a way of support and information?
One of the great committees is the International Haemophilia Training Centre Committee, and so that committee actually provides good education for dentists and caregivers of people with bleeding disorders in aspects of oral health and the way that their bleeding problem can be related to their oral health and how the two interact.
So thank you. It was a fascinating session, and I know everybody was delighted, and they're still in there chatting about it. So thank you from the IADH. It's very, very much appreciated your time spent as a speaker.
Thank you.